According to Dr. David Sackett, professor of medicine at Duke University, evidence-based practice is the integration of clinical expertise, patient values, and the best research evidence into the decision-making process for patient care. He further states that the evidence by itself does not make the decision, but it can help support the patient care process. For my Nurse Fellow evidence-based research project, I chose to look at developing a GI nurse navigator position at my hospital. The reasoning behind my topic choice was 1, colon cancer is the #1 cancer diagnosed and treated at Parker Adventist Hospital, and 2, the hospital was building a cancer care center, which has since opened. I must admit I felt totally overwhelmed when I began this project and wasn't even sure where to start. I chose to start with a literature review as I knew that would give me the necessary background information as well as help me to frame a development process. What I learned was there was that large medical teaching centers throughout the country have GI nurse navigator positions in place. These centers have found that a GI nurse navigator has led to a decrease in their no-show rate for colonoscopies in their GI clinics. While this is great information, I work in a small community hospital, so the GI nurse navigator role could not be applied in the same way here. I chose to do a survey monkey and elicit some feedback from nursing unit RNs, GI RNs, and the GI and colorectal physicians who use our GI lab on how they felt a GI nurse navigator could be used in our setting. I didn't get as much feedback as I would have liked, but I did get useful information. The next step I had was figuring out a systematic process to help me develop the position. I chose to follow a development process that was outlined in 2 articles which were published in Seminars in Oncology Nursing in 2013. These articles were entitled Development of a Breast Navigation Program by Lily D. Shockney, Pamela Haylock, and Cynthia Cantrell, and Oncology Nurse Navigators and the Continuum of Cancer Care by Lori McMullen. The steps in my development process was identifying the stakeholders, engaging the stakeholders, doing a needs analysis as well as a fiscal analysis, defining the scope of the position, launching the position, and finally evaluating the effectiveness of the position. As I began to define the scope of the position, I learned that many areas in our Centura Health system are already using nurse navigators. This included one of our sister facilities, Penrose Hospital in Colorado Springs, Colorado, who had already had a GI nurse navigator in place. I have been able to network with these nurses and learn some of the pitfalls they encountered trying to establish their navigation position, as well as some of the pearls and resources that I might be able to use when presenting my project and hopefully instituting the position. My goal for the position is not only to help patients who are diagnosed with colon cancer, but to assist any patient who has a GI disease. As the acuity of patients on nursing units increase, there is less time for the RN to do appropriate teaching for patients who are scheduled to have colonoscopies, EGDs, or ERCPs. Little teaching is being done on the importance of a proper prep for a colonoscopy. Outpatients who are having a PEG tube placed due to esophageal cancer or uninsured patients who participate in our fixed-price colonoscopy program tend to fall through the cracks as there's no point person to be sure all the necessary elements of their care is coordinated. A GI nurse navigator can help in these situations. Over the past 3 months, I've been presenting my research to the GI staff and GI leadership team, as well as the director of our Cancer Care Center and our Chief Nursing Officer. The next step is to present my project to the senior administrative leadership team at the hospital in hopes we can establish a GI nurse navigator position. I'm learning that you can't create and institute a position overnight, especially in a healthcare environment that is facing reimbursement cuts and increased competition. However, I have been fortunate in being able to present patient stories that show how a GI nurse navigator would have benefited our patients. In the report on the future of nursing by the Institute of Medicine, President Dr. Harvey Feinberg stated, nurses are a linchpin for health reform and will be vital to implementing systematic changes in the delivery of care, and evidence-based practice is how our nursing can accomplish this.